divided risk factors for diabetic kidney disease into two different categories. One are things that are not modifiable. Those include older age. I can't modify my age. Even with plastic surgery, I can't modify my age. Males are more likely to develop diabetic kidney disease than females. Race is very, very important. So if you are African American, or if you are Native American, or if you are Hispanic, or if you're an Asian or Pacific Islander, your overall risk, given everything being the same, is significantly higher for developing diabetic kidney disease than if you're Caucasian. And then lastly, if you have a family history of diabetic kidney disease, if you have a relative who's developed diabetic kidney disease, you're also at higher risk. Now, none of these things we can really change, but there are certain modifiable risk factors. So again, and I listed this first, hyperglycemia or diabetic control as a modifiable risk factor, blood pressure control as a modifiable risk factor, obesity as a modifiable risk factor, taking nephrotoxins, so things that drugs or chemicals that could harm your kidneys is a modifiable risk factor.
Dr. Shader, what are some of those? What kind of things would people want to avoid?
Yeah, so some of those include some of the non-steroidal anti-inflammatory medications, you know, the drugs that we take for, or some individuals take for arthritis, but also
ibuprofen,
Aleve, Advil, you know, the whole list of them.
The Tylenol
is okay, yes. Okay. But then there also are drugs that we administer in the hospital for good reason that can potentially be nephrotoxic as well. Certain antibiotics, for instance. So those are all potential nephrotoxins that should be avoided in individuals who are at high risk or who have diabetic kidney disease. Cigarette smoking is probably the worst thing that you can do. I don't know if it's the worst thing that you can do for yourself, but it's right up there. And then other things, acute kidney injury, usually related to some sort of medical illness, and a very, very high protein diet may also have a deleterious effect on kidney function. So those are all the modifiable risk factors that I wanted to mention.
One of the most important messages I could make for our audience today is, guys, this is serious business. You really do want to prevent kidney disease. And the good news is there's a lot in your hand. All the stuff on the right side of the screen is in your hands. So think about that.